The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, thank you for joining us for the National Eating Disorders Association's Parent, Family, and Friends webinar series. Today we will be presenting Eating Disorders, Body Image, and Pregnancy. My name is Ellen Domingos. I am the Community Outreach Specialist here at NEDA, and I have with me Susie Roman, NEDA's Director of Programs. Hi everybody. And we're very pleased to have with us today our two wonderful presenters, and I'd like to take a moment to briefly introduce them. Dr. Lesley Williams has been with Remuda Ranch since 2004. She is a certified eating disorder specialist and passionate about the work she does with women and girls at Remuda. Her clinical responsibilities include medically managing the care of all adult and adolescent patients. She also oversees the nutritional aspects of their treatment. Dr. Williams graduated from the University of Kentucky College of Medicine. She went on to complete her family medicine residency at Mayo Clinic in Scottsdale, Arizona. Upon completion of her residency training, Dr. Williams joined the Remuda Ranch medical staff. She is a member of the American Academy of Family Physicians and the International Association of Eating Disorder Professionals, and certified as a diplomat of the American Board of Family Medicine. In addition to her clinical duties, Dr. Williams continues to be an active participant of the Remuda Ranch Speakers Bureau. Over the years, she has given numerous local and national presentations on a variety of eating disorder topics. Her areas of particular interest include puberty, pregnancy, and menopause, and their relationship to disorder development. She has also had several appearances on television shows such as The Tyra Banks Show and Intervention. Dr. Williams loves what she does and firmly believes that caring for this unique patient population is her mission. Hi, Dr. Williams. Thank you so much for being with us today.
Hi, thanks for having me.
And next we have Claire Mysko. She is an award-winning author and an internationally recognized expert on body image, leadership, and media literacy. Her book for girls, You're Amazing, a no-pressure guide to being your best self, was named to the Amelia Bloomer list, a project of the American Library Association that recognizes outstanding feminist books for young readers. She's also the co-author of Does This Pregnancy Make Me Look Fat? The Essential Guide to Loving Your Body Before and After Baby. Claire is a sought-after speaker and consultant who works with educators, organizations, and companies that want to reach girls and women with empowering messages. She has served as the director of the American Anorexia Bulimia Association and has held senior positions at Smart Girl and Girls Incorporated. An experienced professional skilled at inspiring audiences to take action for personal and social change, she has developed national media campaigns, acclaimed outreach programs, and pioneering online communities. Claire has appeared in numerous national media outlets, 2020, Good Morning America, the New York Times, and the Wall Street Journal. She received her MA in Gender Studies from the New School for Social Research. We should also mention that Claire is the manager of Proud to Be Me, NEDA's interactive website inspiring self-esteem and body confidence. Hi, Claire. Thanks so much for being here.
Hi, I'm so excited to be here.
So currently, you should all be looking at the control panel, and we have all attendees on mute right now just to control background noise, but we do encourage you to participate by asking your question. We want to provide you with the information you need, so please don't hesitate to use the raise your hand icon and ask a question. You're also invited to type in questions to us using the chat function. And we will have time for questions throughout the presentation and also at the end. And if we don't get to your questions, we will make sure to forward them to our presenters following the webinar and make sure to provide you with the answers. And I also just want to let everyone know that this webinar will be recorded and archived and available to view again through our website at www.nationaleatingdisorders.org under the Media Center tab. So the next, we'll just go through the agenda briefly. Dr. Williams is going to begin the presentation with more of a medical overview and going over issues regarding medical issues regarding eating disorders in pregnancy, infertility, menstrual irregularities, pregnancy and body image, pregnancy outcomes and complications, prevention, postpartum, and treatment. And then Claire will take over, focusing more on the social issues and cultural challenges regarding pregnancy and eating disorders, with triggers, challenges of pregnancy and postpartum, creating a support system, strategies for keeping a healthy perspective, looking critically at media messages about baby bumps and post-baby bodies, and modeling body confidence for our children. So I'd like to now give the presentation over to Dr. Williams.
Okay, fantastic. So we're going to go ahead and get started with chatting about infertility. And I start here because that's one of the major questions that I get from patients that are coming in for inpatient treatment and from their families is, what are some of the long-term complications of the eating disorder, and will this affect my body to the point where I'm not able to have children? One of the good teaching moments in this is that frequently having long-term infertility is not a complication of the eating disorder, and the fact that someone is interested in having kids can be a real motivator for recovery. Infertility is a huge issue. It affects over 6 million people in the United States, and eating disorders have been shown to increase the risk of infertility. In fact, there was a study done that looked at infertility patients overall, and there was a large percentage of them that were presenting for infertility issues but did not reveal to their healthcare provider that they had current or past eating disorder behaviors that might be impacting their issues with fertility. Some of the psychological effects of infertility, many times patients will talk about the fact that, I went too many ahead, sorry, that there's a lot of guilt and shame regarding the fact that they're unable to have children and not knowing how much the eating disorder had an impact, or just feeling really upset that maybe something that they had done to their bodies impacted their ability to have children. There might be a lot of anger involved in just, you know, the fact that they can't have kids. It's something they've been looking forward to and being very frustrated. And it can also exacerbate anxiety as well as depression. So those are just some of the things that we can see in terms of the psychological impact of not being able to have children when you had initially hoped. The eating disorder, the way that it really impacts infertility is due to the malnutrition coupled with the hormonal imbalance. So those two together will make it such that women aren't able to have regular menstrual periods, or maybe they don't have their period at all, and as a result are not able to go on to conceive. And it's interesting, I'll have a lot of patients that can give you a pretty clear history of when they lost their periods in terms of about what weight they were at. And sometimes that can be a motivator to get back to that weight, because they know when I was there, I was able to have periods, and they're feeling more confident about the fact that if I'm able to restore that weight, perhaps I can go on to get pregnant. Sexual functioning can also be an impact of the eating disorder that causes infertility. You know, that's one of the first questions you ask when someone says, we're trying to get pregnant, we can't. Well, how frequently are you trying? And if you are not comfortable in your body and not comfortable in your skin, that might impact your ability to be intimate with your partner and go on to get pregnant. So that can have a huge impact. And just stress and anxiety in general, the way that it can wreak havoc with the body and make it difficult for someone to be able to conceive. The next slide is just kind of a schematic that shows what we call the hypothalamic amenorrhea syndrome, and it basically describes the fact that when the body is malnourished, you are not making all of these hormones that are necessary in order for the ovaries to function appropriately. And that is really what leads to not being able to have the regular menstrual periods. So a frequent question that we're asked is, how long does it take for my menstrual period to return? And this can be variable, and that's one of the reasons why when we look at the new DSM criteria for diagnosing eating disorders, we have changed and taking the fact of not having periods out of the diagnostic criteria because it can vary from person to person. But typically, if someone has lost their periods as a result of their eating disorder, it will return within 6 months of achieving and maintaining at least 90% of ideal body weight. And usually that requires about an 18 to 22% overall body fat percentage. And that can be a real education point because frequently patients will say things like, I want to restore weight, but I want it to be all muscle. I don't want to have any fat, zero fat. And fat is an important thing. And we need fat in order to make a lot of those hormones that I showed in the prior slide for us to be able to have normal menstrual periods. So that's why body fat is an important piece of the puzzle. So not just the weight percentage, but the body fat percentage as well. Sorry, I know that going to the next slide should be the easy part, but it takes a minute on my side, sorry. So warning, I always caution patients that have gotten to the point where maybe because of their malnutrition they're not having menstrual periods at all. It does not mean that they cannot conceive. So that is not a form of contraception of, oh, my period's gone away because I'm low body weight, so I can still, you know, have intercourse and not worry about that. Pregnancy can actually occur once ovulation resumes, which could precede the patients actually getting their periods back. So it's important that if you're not trying to get pregnant, you're still using contraception when you're not having your menstrual period, because the last thing that someone wants who's in the midst of really working hard for recovery is an unexpected pregnancy. Typically, that's best done once you've gotten a little bit further along in the recovery process. Next, I'm going to talk some just about menstrual irregularity. So before we were talking more about amenorrhea or not having your period at all, but there can be some in-between zone, if you will, where the periods just aren't regular and regimented as the body typically would have. So 7 to up to 40% of women with normal weight bulimia have amenorrhea, and anywhere from 37 to 40% of women with bulimia had irregular menstruation or showed some spotting. That was a study that was done. So their menstrual irregularities are not specific to anorexia. We also see that in patients with bulimia, and they think part of that has a lot to do with all of the hormonal stresses that happen with the body, especially when you're engaging in binging and purging behaviors and with significant weight fluctuation. They found that both binge eating and vomiting have been found to be related to menstrual irregularities. Also, there's been some relationship between appetite suppressant abuse and the way that it can impact the prolactin levels and also lead to menstrual irregularities. So this isn't something that is specific to patients with anorexia. In terms of sexual functioning, I had kind of touched on this earlier, that nearly 2/3 of women with an eating disorder report that they have loss of libido and they have significant anxiety regarding having intercourse. So again, women are going to be less likely to engage in intercourse because of some of the anxiety, stress, tension that might come into play when you're looking at the eating disorder. And I've already touched on this, is #1 rule of infertility workup. If you're not feeling comfortable in your body and you're not having intercourse, you're not going to get pregnant. And so that's just an important piece of the pie to look at, as well as when you're looking at a patient's past weight history, the weight that they were at when they had their last menstrual period are all kind of important pieces of the puzzle. So, normal weight, now what? And even though I said a large percentage of patients will get their menstrual period back as well as return of normal fertility, this can be delayed in up to 30% of women who have achieved their ideal body weight. And so that is kind of the area that we want to focus on, is that although once the majority of patients are able to restore their weight, they'll get their regular periods back and fertility will return, there still is this large percentage that might still have ongoing issues in terms of fertility. So the treatment recommendations would be, of course, first and foremost, to screen for the eating disorder symptoms and to ask for them and try and educate even more people that work with patients that have infertility issues to ask those important questions. And first and foremost is to treat the eating disorder, to be able to get the person to discontinue the behaviors, restore and stabilize their weight, make sure that they have adequate support, make sure that they're dealing with any stressors or anxiety that may be going on. And then if there still are ongoing infertility issues, look at some of the other treatment interventions that can benefit, such as medications and things of that nature. So even though the reproductive organs can be affected by the eating disorder and the stress and anxiety, in the majority of patients, if they're able to restore their weight and stop the behaviors, fertility can be achieved and will be achieved. So pregnancy and body image is the next piece, and I know that Claire's going to touch on this, but I'll just talk about it briefly. Pregnancy is a huge change in any woman's life. It can be overwhelming. All of a sudden, it's this idea that my body's going to change, I'm going to have no control over it, and people all of a sudden are very interested in your body and making comments about your body. So it's just a really vulnerable time for women in terms of body image concerns. So first and foremost, I think, is having open dialogue. We're all very excited about the fact that a baby's on the way and all the excitement that can go along with that, but we really need to have open dialogue with that woman about, how do you feel about that? Do you have fears about how your body's going to change? Discuss realistic expectations about weight gain and things of that nature, and just really not forget mom throughout this process and time of excitement. In terms of bulimia in pregnancy, there have been some conflicting studies regarding behaviors during pregnancy. There was one very small study that looked at 20 normal weight bulimic patients, and they noted a significant reduction in their eating disorder symptoms during pregnancy. And in fact, up to 75% reported complete cessation of binge purge behaviors in the third trimester. And what I found when I talk to patients so frequently is that this idea of having a baby inside of me and someone to care for really gives them an opportunity to put their eating disorder behaviors on the shelf and really focus on that baby. So it can, for some people who are able to kind of put the body image issues aside, it can be an opportunity for respite from the eating disorder and just an opportunity to really focus on someone outside of themselves. In terms of morning sickness, that can really be another vulnerability. People anticipate that women are going to have morning sickness, that you may have some vomiting, and so that can bring up an opportunity for women to engage in eating disorder behaviors and even mask them behind the pregnancy. And so it's just important to be able to ask those important questions. Some patients might require nausea medications or meal supplements. In very rare cases, patients might even require hospitalization. And I've had patients in the past that had to spend a huge part of their pregnancy actually in the hospital because of what the doctors thought was intractable nausea and vomiting due to the pregnancy, but in actuality, it was the patient's eating disorder was really out of control due to the pregnancy. Food cravings can also be an area of vulnerability during pregnancy. They may fuel binge urges or fears about binging and then restriction. It's really thought that food cravings just reflect our changing dietary needs during the pregnancy process, and that you may be having cravings for things that the body needs or the baby needs that you wouldn't typically eat. So it's just another opportunity to encourage people that it's nothing to be embarrassed about or feel guilty about. It's something to talk about and deal with and see how this could potentially impact eating disorder behaviors. Be aware that some women may use pregnancy as an opportunity to excuse what we describe as orthorexic behaviors. It's like, now that I'm pregnant, I have to eat very super healthy, and I have to do all of these things all in the name of the baby. And they become very restrictive in their intake, very fearful of eating different types of foods. And so just the desire to be healthy for the baby is normal, and it's something that we would encourage, but just recognize that that can sometimes be a springboard or a platform to really start engaging in some severe restriction in the name of the baby, and again, maybe potentially mask some underlying eating disorder thoughts that might be going along with those dietary changes. There are several studies that do indicate that some participants who continue to engage in the eating disorder during pregnancy, but as a rule, the majority show that there is a decrease in at least the frequency and the severity of the eating disorder symptoms during pregnancy. And many women state that pregnancy really had a positive psychological impact on them, as I mentioned before, this sense of purpose, this sense of having someone to take care of, and it really kind of took the focus over the eating disorder, which might have really had the primary focus in their mind prior to getting pregnant. So next we're just going to touch on some of the outcomes and complications related to pregnancy and eating disorders. So some of the pregnancy complications that we can see are miscarriage, decreased bone mineral density. Again, the body is going to be consuming more calcium and have a higher calcium need. Preterm labor and birth are very commonly seen with eating disorders and pregnancy. Breech presentation, and I don't think they really 100% understand why, is increased actually among patients that have eating disorders, and C-section delivery is also increased. This was a study done in 1994 that looked at 24 women who reported prior problems with disordered eating, and among those women, they had higher rates of complications such as intrauterine growth retardation, edema, gestational diabetes, vaginal bleeding, and those women were more likely to have infants with low birth weights as well. In terms of the birth outcomes, not just the pregnancy outcomes, we will see, as that study showed, that the babies are at increased risk to have a low birth weight, to have respiratory issues, microcephaly or a small-sized head, intrauterine growth retardation, cerebral palsy, cleft palate, blindness, learning disabilities, as well as a mood disorder later in life were all cited as potential birth outcomes related to an eating disorder and eating disorder behaviors during pregnancy. So what are some of the things that we can do in terms of prevention? First and foremost, prenatal vitamins are always a good choice to give the women as well as the babies the extra vitamins that they need during that pregnancy period. Doing blind weights during the prenatal visits is really huge. You would be amazed what a huge impact that can have, because again, for any of you that have been through the prenatal visits, the huge part at the beginning is getting weighed, graphing that out, seeing how you're gaining weight. And for most women, it might not be triggering, but for anyone who has struggled with the eating disorder thoughts, that can be a very triggering experience. So weighing the patient blindly, focusing on the health and the growth of the baby instead of the health and the growth of the mom. So instead of saying, oh, you're gaining weight, or you're gaining too much weight, or you're not gaining a weight, talk about how the baby's growing and how the baby is getting healthier and stronger. openly discussing body image concerns, having that be a discussion point at each visit to see how she's dealing with that, asking specifically about eating disorder behaviors, counseling regarding what appropriate exercise during pregnancy would look like, and referring to a registered dietitian early on in the pregnancy to be able to provide that additional support and coaching in terms of what dietary needs are required. And in terms of things that can be done during the postpartum period, this can also be another time of vulnerability for a mom. Frequently, women may suffer with postpartum depression. There's been, so much excitement and build up to having the baby, but now the baby's here, and there's an overwhelming amount of responsibility and stress and anxiety, and so it really sets up for the potential for postpartum depression, for increased anxiety, and that's also a time where I feel that women feel very vulnerable in terms of returning to eating disorder behaviors, even if they were able to discontinue those during the pregnancy. So there's 3 times the risk for patients with bulimia nervosa or binge eating disorder and those with bulimia nervosa who have had who have had a history of anorexia to have postpartum depression. So the eating disorder is also going to make you more vulnerable to suffering with postpartum depression symptoms. The other thing that can really have a huge impact during the postpartum period is this societal pressure to lose the pregnancy weight instantly. It's almost impossible to go to the grocery store and not see someone featured on the cover of a magazine who had a baby last week and now has lost 50 pounds in a week and is in a bathing suit with their newborn. And it really just sets a lot of unrealistic expectations on women in terms of how quickly they're supposed to lose their body weight, how their bodies should look post-pregnancy, and it just can really set the stage for an increase in eating disorder behaviors, these unrealistic expectations about how the body changes throughout pregnancy and what it may look like afterwards. And I think it also sets a lot of fear in women also that maybe is unfounded in terms of that there's going to be these huge changes that happen to their body. So one way that I try to couch that with patients is, look, it took 10 months for your body to go through all of the changes that it needed to prepare for the delivery of this baby. It's not going to go back overnight. And that we should really talk about realistic expectations in terms of postpartum body changes, how long that typically takes for the body to change and get back to what it looked like prior to the pregnancy, to encourage them that that is possible, that their body, the day that they have the baby, isn't the same that their body will be a year after that or 2 years after that. So just really, again, that open dialogue and discussion about the body changes that can occur. Many women will resort to radical diets and use of substances in an effort to accelerate their post-pregnancy weight loss, and that is something that we definitely want to not support. It's going to make it difficult during that postpartum period to really focus on the baby, and do what you need to do to care for your child when women become so entrenched. But it's not uncommon that we'll see patients that present at an inpatient level of care in that early postpartum period because their eating disorder after they gave birth just got so out of control. So use of substances, low energy, and poor postnatal health can really negatively impact baby and mom and their ability to bond during those crucial months after birth. Even among women who really experienced a remission of their eating disorder symptoms during pregnancy, a large percentage of them will relapse within those first 6 months postpartum. So it's very important that providers are aware of that, that family members are aware of that, that even though we're caught up in the excitement of the baby, again, not forgetting mom and asking those important questions about how she's dealing during that postpartum time. And then breastfeeding can be another area where we need to address the potential of eating disorder behaviors. It can cause some additional postpartum stress, not knowing how to do it, not knowing if you're doing it right, just high anxiety. It can require a higher caloric intake. Even for some women, it may be higher than what they were doing during pregnancy in order to keep up with the needs of the body that's breastfeeding. And for some women, it can be used as a form of purging, if you will. So they are kind of obsessively breastfeeding because they've heard that it burns so many calories, so they're using that as a way to purge calories. And again, it's something that people are less likely to question you about because, oh, you're a new mom and you have a newborn. And we've actually even had patients at the inpatient level where their baby is, significantly older now, and they want to pump milk constantly. And I had to kind of, discuss with them, like, let's look at your baby. You told me yourself your baby wasn't even growing appropriately at home because the breast milk that you were providing because of your malnourished state was not sufficient. And that at this point, you and your attempts to breastfeed really have more to do with your concerns about calories than it does to do with the health of your baby. And for some women, depending on where they are in terms of vulnerability, breastfeeding might not be the best choice. And this one patient in particular, I had to tell her, it's really time for you to transition. You are inpatient because of your malnutrition. Your baby has fallen off the growth curve because you were not feeding it adequately. It's time for us to talk about weaning, for the baby to get the nutrition that it needs from formula, and for us to focus on your eating disorder. So pregnancy can really be an ideal time for intervention. Studies have found substantial improvement in eating disorder symptoms during the pregnancy, and women often describe this freedom to relinquish the pursuit of thinness, that the concern for the baby and the baby's wellness really kind of would overtake their desire to engage in the eating disorder behaviors. And so we just want to stress that importance of nourishment of the baby, of health, and of living a healthy life. And also there is some thought that some of the hormonal changes can positively impact the thought process of the mom and decrease her eating disorder symptoms as well. So in terms of treatment strategies, first and foremost, I always counsel my patients to postpone pregnancy if they are active in their eating disorder. And even if they're in recovery, I recommend that they get a good 12 months under their belt of solid recovery before they look at trying to actively get pregnant because of all the vulnerabilities for eating disorder relapse that we just discussed. It's important to focus on treating the eating disorder first to really make sure that those behaviors are under adequate control before getting pregnant, provide adequate prenatal nutrition and counseling, give patients good education regarding weight gain and their nutritional needs during the pregnancy so that they can feel confident that they're eating appropriately, making sure to refer to a specialized eating disorder provider to help as indicated during pregnancy, make sure that obstetricians are notified of the presence of the eating disorder. Patients might be a little bit gun-shy about providing that information. And so asking, can I speak to your doctor as a family member or as another treatment provider and let them know that you struggle with this so that they can really help you along that process. Because oftentimes the focus for a lot of obstetricians is making sure that people don't gain weight, and a lot of fears about that, don't gain too much weight, I should say, and fears about that, and they may not be as in tune to needing to have the sensitivities to someone who has had an eating disorder in the past. Watching very carefully for any signs of postpartum depression or eating disorder relapse and intervening as appropriately. Identifying new mom support networks is huge. Can be a very lonely time. It can be a very stressful time, so making sure that those support networks are put in place. Encourage breastfeeding when appropriately and monitor the infant growth closely to make sure that the breastfeeding is going well and positive for both mom and baby. And in terms of moms with eating disorders, some of the things that we see is the breastfeeding difficulties that I talked about. Maybe they have issues with feeding their children. Sometimes women, because they're very concerned, maybe they were overweight as children or they're just fearful, we might find that they're underfeeding their children or maybe sometimes overfeeding their children to compensate for calories that they're not ingesting. It can cause some significant mealtime conflict. Sometimes the infants will be of lower weight. They may have difficulties interacting. They may be very focused on perfectionism around food. So those are some of the symptoms that we could potentially see of moms with young kids that are suffering with their eating disorder. So some of the treatment interventions is that just treating the parent doesn't deal with the risk to the child, so making sure that we're educating moms that suffer with eating disorders how that eating disorder could potentially impact their children, really giving them opportunities to do meal coaching within their own environment, or even inviting their kids in to be able to do meals as a family and see how that eating disorder can impact the entire family, doing meal planning with the family, really focusing on playtime with the kids and trying to get away from some of the mealtime stress that the eating disorder can sometimes put, having positive relationships around food, finding strengths, maybe educating them on developmental trends in terms of the kids' eating habits, and maybe even doing some interventions around meals at home are all things that we can do when you're working with a mom that has eating disorder that also has young children at home and is responsible for feeding them.
Thank you so much, Dr. Williams. And we've had some questions that will take a little bit of time to ask you now, and also just letting the audience know they're welcome to type in questions about anything that you've covered so far. And maybe I could just start it off with a very common question that we had. Quite a few people wrote in saying that, as you pointed out, that they had a stopping of eating disorder symptoms during the pregnancy, but very concerned about relapse afterwards, and just asking about strategies for preventing a relapse after they've had the baby, and anything else that you would tell women who are currently anticipating that kind of a challenge.
Absolutely. So yeah, that postpartum period is really an area of vulnerability. I think some of the things that I would recommend is making sure that they go ahead and set up, if they had a struggled with the eating disorder prior to the pregnancy and maybe haven't been seeing their outpatient team as frequently, going ahead and setting up those appointments ahead of time, even before delivery, because we know that the chances are high that there's going to be some struggles, and once the baby comes and there's so much going on, that kind of falls by the wayside. So if you already have those appointments kind of prophylactically set up so that you know that you can anticipate that and have an opportunity to check in and talk about some of your struggles, I think that that's one good way. And also just letting family and friends know that you're close to, that like, hey, this is something that I struggled with. I'm doing great now during the pregnancy and I'm excited, but I understand that the postpartum period might be an area of vulnerability. Just giving them permission to check in with you and see how you're doing. You know, those are some of the things that I can think of that would work prophylactically, is setting up appointments with your providers, letting family and friends in, and then just being open and really honest about how you feel about your body and how the eating disorder kind of chronicling, if you will, eating disorder thoughts and behaviors during pregnancy, and then in those first few weeks to months afterwards, kind of keeping track of those. So if you see that there's an increase in those thoughts, that you can do something to intervene early.
Great, thank you. And you know, you were just talking about the importance of communication with people in your life about these issues. And we had a couple people who wrote in about talking to their partner. So one from a partner, one from the person who is concerned about themselves, and said that, I'd love to get some tips on how to talk to my husband about my fears about being pregnant and having a kid with Ed still in my head. Could you give some tips about how people might approach talking to their partner anticipating that?
Absolutely. I think, thanks for bringing that up, because that is a huge piece of the puzzle. I think it is so important to have that open dialogue with your partner, letting them know right off the bat, like, this is something that I've struggled with, that I'm concerned about. Again, kind of giving them some ideas of comments that to avoid, you know, not making a lot of focus, saying things like you're getting fat or you're gaining weight, but focus more on the baby, you know, giving them real specific strategies on ways that they can be supportive and we can be excited about the pregnancy and excited about the baby, but to try and not make as much focus on the mom and how her body's changing, but couch it more as how the baby is changing and growing and focusing, and just letting them know that this is an area where I'm struggling, and giving them an opportunity to be able to check in about that and ask how you feel. But I think one of the big things that I see for a lot of women are triggers of their partner making specific comments about their body in a negative way. And so that would definitely be a discussion that would need to be had as soon as you find out you're pregnant, I think.
Great, and I think you've sort of already covered this in your last response, but somebody had asked, as the partner, how they can be sensitive to their partner who's recovering from anorexia and may currently have orthorexia. How can this person help her recover, and what is the relationship between eating disorders and psychological illnesses like OCD and depression?
Excellent question. So I think part of that is what I said about the body image piece. Another part about that might be just working together on the needs of, especially if orthorexia is a part of it, is just the needs of the body in terms of fat and different nutrients throughout the pregnancy, and also the needs of the child. I think education around that for both parties can be huge, because it can be a little disarming when a woman's like, oh, I'm just being healthy for the baby, and being able to kind of have some information in terms of the fact that the baby's going to need protein, the baby's going to need fat, the baby's going to need all of those different things for a good development, I think would be important for both the mom and the partner to be educated about. And then in terms of the overlap with depression and OCD, there is a huge overlap with that, as well as eating disorders. We can see depression that precedes the eating disorder, and also that comes as a result of the eating disorder. And OCD and all anxiety disorders, but particularly OCD, can definitely make patients very vulnerable in terms of eating disorder behaviors, because it kind of gives an opportunity for the OCD to flourish, and the calorie counting and rituals and thoughts about food. And so again, a treatment plan or a treatment that looks at those specific underlying diagnoses and treats them in conjunction with treating the eating disorder would be important.
Great, thank you. And I'm glad that you mentioned the issue of exercise, too. We've had quite a few questions where people have asked about what are the potential risks of cardiovascular stress if they're running a lot, or if they're engaging in behaviors that, they're perceiving to be healthy for the baby, but wondering what sort of constitutes overdoing it. And in particular, someone asked, if you have a history of restricting food to one meal a day and excessive exercise, would something like prenatal yoga be appropriate, or would that be something to avoid?
If it's someone that has struggled significantly with over-exercise, I think that the last thing you want to do when you find out you're pregnant is all of a sudden start engaging in some new exercise regimen that you weren't doing before. That's definitely something that's cautioned against. If the exercise hasn't gotten under adequate control prior to getting pregnant, it would be an opportunity typically to try and cut back on that some, because there are some risks of the baby not being able to get everything that it needs because of the stress that the over-exercise can put on the body. There are certain things like prenatal yoga and different things like that that can be more appropriate during the pregnancy. They're a little bit gentler and not as stressful on the body and potentially on the baby. And I think that determining what's appropriate for each person would really be best done in conjunction with their treatment team to know where they're at the time that they got pregnant, because they can be anywhere along that continuum of in the midst of their eating disorder versus in recovery, and that will help gauge kind of what level of activity would be appropriate for them during pregnancy.
Wonderful, thank you. And earlier you were talking about the issue of purging being mistaken by medical professionals as morning sickness, and somebody was asking, how do you know the difference between purging and morning sickness? And I'm not sure if this person is supporting someone or referencing about themselves, but maybe if you're supporting somebody and you're concerned that that's what's actually happening. Is there any way you could tell?
You know, that's really, really difficult because it can so easily be masked. For the majority of women, morning sickness is going to mainly occur in those first trimester to the second trimester, and then it should improve. There's a very, very, very small percentage of women without an eating disorder that would have unrelenting vomiting throughout the pregnancy. So it usually has kind of that cyclical pattern where it's a little bit worse at the beginning and then gets better. So that is something in general in terms of patterns that you would see. Again, it's called morning sickness because it typically is worse earlier in the day and can get better as the day goes on. But it's really hard because it's so unpredictable in terms of the symptoms that are true versus symptoms that could be the eating disorder. But I just think if you know that someone has struggled with the eating disorder in the past, having a really low threshold to check in with them and find out, you know, how they're doing. Most of the women who have just morning sickness due to pregnancy are going to respond really well to some of those anti-nausea medications. Again, only a small percentage would not respond to those, so that would be another hint that, hey, maybe there's something else going on like this, and there might just be other comments that they're making about their body or about their fears that might be clues that there's something beyond just the morning sickness that we're dealing with. And the morning, it could have started as morning sickness, but because it was so easy and so acceptable, it helped them to kind of continue with the behaviors afterwards. So it can be a little hard to tease out.
Great, thank you. And I know we probably have time for just a couple more questions before we'll move along in the presentation. So if anyone has a question you want to submit, could get that in now. And we did have someone asking, if I binge while pregnant, what kinds of effects could that have on my child?
Binging behavior itself, I think the big concern about binging during pregnancy has a lot to do with, you know, we're worried about patients not gaining enough weight, but we also worry about patients potentially binging to the point where they gain an excessive amount of weight, which also puts the baby at risk of gaining an excessive amount of weight, and then there can be issues in terms of gestational diabetes or the baby size being so large there's difficulty with delivery and things of that nature. So I think the fear with binging has more so to do with if it goes on continually throughout the pregnancy and there's a significant weight gain during the pregnancy, some of the complications that go along with that.
Great, and we have a question that's related to nutrition. Somebody's asking, what credentials should one look for in a nutritionist, maybe helping someone along in their pregnancy who is currently or previously affected by an eating disorder?
So if the person is pregnant, started working with a dietitian, but has a history of an eating disorder, I definitely think trying to work with a dietitian who has experience in both areas. You know, preferably someone who has like a certified eating disorder specialist or someone who has some history of working with eating disorder patients so that they can see kind of both sides of the coin. Because frequently dietitians that work exclusively with patients that are pregnant are going to be more in tune to making sure that they're eating appropriately and not gaining too much weight, and they may not be able to pick up on some of the more subtle flags, red flags, and concerns of patients that also can have a co-occurring eating disorder. So I think someone that has experience in both areas and just asking them that at the onset would be great. If you're looking for credentials, I think a certified eating disorder specialist would be the ultimate, but I just think someone that has experience with both would be a plus.
Great, thank you. And I think that's all the questions that we have for now. Thank you so much, Dr. Williams. And it's so helpful, and I know that people may have questions that you think of as we continue, so please feel free to type those in, and we will have a little extra time at the end to do any final questions. So at this point, we're going to go ahead and turn this over to Claire in just 1 second here. All right, Claire, here you go.
Thank you. Well, thanks everybody for joining. I'm really excited to be part of this. This is a topic that I've spent a lot of time researching and writing about as a professional in the field, but I also want to put it out there that I'm a mother with a history of an eating disorder myself. So this is something that I've been personally affected by. And I'm going to talk a little bit about that and about my process for writing the book and what I learned in writing Does This Pregnancy Make Me Look Fat? When I first started researching the book, I was at a point where I was seriously considering starting a family myself. My co-author was a mother at the time. And, you know, for me, I had been in strong recovery at that point for over a decade, but I did have a lot of concerns about all of the potential triggers. And I thought, well, what better way to educate myself than to talk to more than 400 other women about the topic. So that's what we did. We surveyed over 400 women. At all points, we surveyed women who were thinking about getting pregnant, which was the category that I was in at that time, women who were currently pregnant, and then many mothers as well. And so what I'd like to do in this presentation is sort of pull some of the key themes that came out of those interviews. And, you know, of course, pregnancy and parenthood, they're very individual experiences, but we did find that there were some themes and concerns that came out in nearly every interview and every survey that we looked at. So number one, and you'll see this slide now, is that 78% of women we interviewed said that they had concerns about the body changes of pregnancy and motherhood. Yet less than half of them said that they talked about those fears with their friends or their partners. And we found that it was almost an exact percentage with the number of women who said that they had histories of eating disorders and body image issues and talked to their prenatal and postpartum health care providers. So there's a tremendous level of silence happening here around these issues. And you know, as Dr. Williams pointed out, one of the really important things, and this was so true in my experience and from all of the women that I've talked to, is that it's just so important to talk about it and, you know, to reach out for help. And so many women are feeling embarrassed about this. We often hear that, oh, well, I should just be focusing on the baby and it's selfish for me to be worrying about my body image. You know, that was a common thing that came up. So, you know, just really to stress this idea, number one, that it's so important to talk when you have concerns and to reach out for help. So I'm going to talk and go through some of the common triggers that came out in my conversations, and Dr. Williams has touched on some of these, and I'll just expand on them with some anecdotes and stories that from women that I've talked to. These are the major ones that came up. Obviously, pregnancy, and postpartum, there's an intense focus on weight, body size, and diet. This happens, you know, as Dr. Williams mentioned, you know, oftentimes in the doctor's visits, you know, the scale is the centerpiece of those visits for many. So that's an issue. And then culturally, there's this idea that we should be focused on weight and body size and diet throughout is validated constantly. So that's something that is really important to navigate in a way where you're being open and honest about your fears about and anxieties about that. The lack of control, you know, there's a lot of stuff going on, and a lot of it can feel very overwhelming. So there's this feeling of total lack of control, which can trigger a lot of the underlying issues of eating disorders. This idea of having the perfect pregnancy, and then after the baby's born, getting right into this idea of having to be super mom and do everything. Certainly feelings of isolation. It can be a lonely time, and to make sure that you're reaching out, again, for support. Common theme that came up was memories of past trauma, which can happen during pregnancy, so to make sure, again, that you have your treatment team and your support system in place so that you can talk through that and get the help you need if that's happening. And then, of course, you know, when you're about to become a parent, you're going to be reflecting on your own family dynamics and how, and again, oftentimes that plays a big role in the development of eating disorders, so that can be an issue too to think about. So, getting back to the specific triggers and this idea of the, overall focus on weight, we talked to a lot of women about this. This is a quote from a woman, a 32-year-old woman, who says that she tried to keep a mental note of everything she was eating, to keep it in check, writing everything down, tracking calories, tracking how much she gained to make sure she wouldn't go over what the doctor recommended. This came up a lot. And again, it can often be validated by the doctor if you're not working with a doctor or not seeing a doctor who has a sensitivity to these issues. And when I was pregnant, it was very important to me to not track my own weight. I hadn't weighed myself throughout my recovery, so I never knew what I weighed, and I certainly wasn't going to go into pregnancy and then suddenly be weighed at every doctor's visit. So, I walked right into, and it was an important part of the interview process when I was looking for an OB to be upfront about my history, even though I had, as I said, I'd been in strong recovery for many years. But it was really important to me to find somebody who was going to be sensitive to the issue, knowledgeable about eating disorders and body image issues. And, I put it out there right away that I did not want to be told my weight. They could weigh me, but I didn't want to keep track of it myself. And so that really took away a lot of that pressure to track things myself. My doctor said, look, I'll let you know if it's a problem. But, it was really more about, for me, it allowed me to focus on, the growth of the baby, all the other exciting things, and sometimes overwhelming things, but weight was out of the equation for me, and that was really important. And I think for a lot of women who struggle with body image and eating disorders, that's going to be really key to make sure that you're not tracking that number and focusing on that number. This issue of control, it came up at all points of the spectrum. A lot of women we talked to who were pre-pregnant named that as a big issue. That they've gotten to the point, this is a quote from a 25-year-old woman who's thinking about having a child. She said, she's gotten to the point where I know my body, what it can do and can't do, what it needs to stay healthy, and I fear the changes. She felt like she had everything, kind of in a place where she felt comfortable, and what are these changes going to do? What could they potentially trigger? And then again, this issue of selfishness comes up a lot. I feel really selfish in thinking this. This is a lot of women feel this way, that it's not okay to have these fears, that they're going to be judged for having them. And again, I just want to stress, so many women feel this way. You're not alone if you feel this way. There's no reason not to reach out for help and talk about it if this is what you're thinking. This idea of the perfect pregnancy, and again, after the baby's born, having to be the super mom. And this is a quote from a 34-year-old woman we interviewed who, she had a really tough pregnancy. She had a lot of physical complications, and everybody was asking her about, every aspect of her pregnancy, and she felt like there was a lot of judgment on how much weight to gain. And I'll add, if you are not tracking your weight, there's a really nice, easy answer to that, which is that I have no idea. And it's really nice to be able to say that, and it shifts the conversation very quickly to more meaningful aspects of the pregnancy. So, again, I would put in a plug for really, if you think it's going to be a trigger, just take it out of the equation. But again, getting back to this idea of perfectionism, she felt this need to say that everything was okay. Everything's fine. It felt easier for her to just put on that happy face that we all who struggle with these issues know so well. But really what you're doing is closing yourself off from the opportunity to deal with the issues, and she really struggled a lot with that perfectionism, and it was very triggering for her. Isolation. This is a big issue for new mothers that came up a lot. This is a woman that we talked to, 35. She found herself binging to cope with the loneliness and the fears that she had while she was home alone. She felt very isolated and trapped. Her partner went back to work, and she was home alone. She did not have a strong support network, which I would really echo what Dr. Williams said about making sure that you have that support system in place throughout pregnancy, but also as a new mom. Find support groups, reach out to your friends. Oftentimes friends think like, oh, they're totally overwhelmed with the baby, and I'm going to give her space, but and in fact you're just sitting at home alone and freaking out. So like make sure you're reaching out to people who can really support you and make sure that you're not closing off and closing up.
Claire, do you mind if we stop for a second to ask a question that's really relevant to what you were just talking about?
Sure.
Great. So somebody had said, what can the father do to be sensitive to what the mother's going through during and after pregnancy who has or has an ED? And what actions can the father take to alleviate the stress involved? So in the realm of having that social network, and what can people do to help you with your anxieties?
Yeah, well, I think, again, having that open dialogue and, starting to talk about it and starting to talk about the fears, early on. And, I'm going to get into a little more specifics about strategies, but I think really partners can be such a key part of helping to set and reinforce boundaries. There's going to be a lot of focus on the body and weight and food, and to really talk through and actually come up with a game plan, like how can your partner help you run interference in certain situations where you might be dealing with a family member or somebody who might be not so sensitive to these issues, things like that. And again, I would echo what Dr. Williams said about really partners can really help to shift the focus to like the amazing thing that your body is doing, and the fact that the baby's growing, and really shifting the focus back to the excitement of the process, rather than this focus on numbers and.
Great, thank you.
Sure. So again, just to bring this up, we did talk to a lot of women who had histories of past abuse and trauma. It's very common among people who struggle with eating disorders. So it's important, again, to make sure that you're processing these memories when they're happening, so that you're not resorting to disordered eating or other self-destructive behaviors to try to cope with the stress of that. And yeah, you're going to start thinking about, as you move into parenthood yourself, you're going to start thinking about your relationship with your own parents, your own family. Sometimes that can bring up these feelings about how family dynamics might have played a role in your own eating disorder. So here's where, again, keep using this phrase support system. What does that mean? What does that look like? Stressing, again, your prenatal and postpartum health care providers must be knowledgeable and sensitive to eating disorders. And it's important because so many women, an overwhelming number of women who have a history of these issues who we talk to do not even disclose that fact to their healthcare providers. So that's number one. You have to take the initiative, and sometimes it's really scary. And sometimes a lot of women we talked to said, well, it was far in my past, or I just didn't feel comfortable, and I don't feel like it's such an issue for me anymore. There were a lot of reasons why women were hesitant to discuss it. For me, it was pretty far in my past too, but I just knew that I wanted to find somebody who was going to be sensitive to these issues, and the only way that you can discover that is if you actually talk about it. So that's really important. And this is getting to the question that was just raised. You can recruit your partner, and partners can step up as advocates for your health, your emotional health, and as you're thinking. in place. Reach out to anyone who you think would be helpful to you as you go through this process. And again, ask for help. Ask for help out, not isolate yourself. Okay, here is a helpful partner. There's like a very specific example. This Sarah, she's 33, new mom. She said every time I had a little breakdown about my weight, my husband would point at the baby and say, "Look at that, she came out of you. You clearly had to make room." So again, shifting the focus away from the weight, trying to help your partner with this anxiety by focusing on what's important, and also the amazing thing that your body has accomplished and is accomplishing. So that's a way again to shift the focus away from the negative. Just some tips. Again, sort of reiterating some of the key points. Discuss your plans before with your doctor, your therapist, your treatment team, to figure out if this is an appropriate time, and what your concerns are. Get your plan in place. It's important to accept that your body is going to change, and that a lot of times women, and this was true for me, it was pregnancy helped me to appreciate my body in a new way, but it can also bring up a lot of anxieties and fears. So if you are really struggling or you have a history of issues, don't assume that pregnancy and motherhood is going to resolve them. It's important to have that help. Again, choose healthcare providers who are savvy and sensitive. Very unfortunately, talked to many women who ended up with healthcare providers who were not so sensitive, and their experiences ended up in their doctor's offices, and sometimes a few women even in the delivery room ended up being triggering to them. So as soon as you can find somebody you feel comfortable with, who's not going to be overly focused on weight and weight gain and your body, and who has some knowledge of body image issues, that's very, very important. Again, support network, make sure you've got people around you, and set boundaries. There are just who could not believe or predict the bizarro things that will come out of people's mouths in relation to your body and what's changing, and it's just, we have a chapter in the book called the WTF files, and it's just really quite shocking. Even for me, having written this book and hearing these stories, I still was pretty amazed at some of the totally inappropriate comments about my body. So, I think for those people who are around you, who to be like, you probably have somebody in your family or coworker who you can sort of predict that there might be some weight-related or comments that might be triggering. To try to set your boundaries, come up with some responses. Again, that's another thing that's so beautiful about not tracking weight, because that question that comes up about, oh, how much weight have you gained, or how fast have you lost it after? If you're not tracking that yourself, you can just so quickly disengage from that, which is good. And yeah, engage your friends and your partner in helping you to set those boundaries. After the baby arrives, remember that your physical and emotional health are important for your baby's health. Unfortunately, in the American healthcare system, you have your OB, you're monitored so closely throughout pregnancy, and then the baby's born, and you'll probably have your 6-week checkup, and unless there's some major issue, it's like, see ya. So you make sure that you've got, if you are having problems, that you are making the call to your healthcare provider. I had a doula, which I found to be very helpful both during the delivery and postpartum. She came and checked in on me, and I had already talked to her about my history with eating disorders, and it was a good opportunity to feel like, hey, somebody's looking out for me. There's so much focus on the baby, and you have to be so focused on the baby in those early stages. So it's really important yourself too. You know, as Dr. Williams mentioned, there is just an incredible amount of toxic stuff out there, and I'm going to go through a little bit more detail about that. But you know, resisting these messages that promote the idea that we should be so immediately focused on getting our bodies back, and you know, you see all this stuff about you know, the post-baby body reveal, and you know, it's so unhealthy and unrealistic. And you know, we talked to many women who were so focused on trying to get the weight off after the baby was born that, you know, they look back on that experience and say, you know, that they really missed out on some important bonding time because their mind was completely on getting the body back and losing the baby weight. Again, looking at your recovery as an ongoing process. You know, you don't have to be perfect. You know, if you're struggling, that's okay. You don't. The most important thing is that you're asking for help. So yeah, I'm just going to go into a little more detail about this media stuff because it's gotten way worse. When I was researching the book, it was in 2000. We're looking at like the early to mid 2000s, and what we found was that between 2003 and 2005, that's when it happened. I don't know what it was. They figured out that there was a lot of money to be made, but the number of magazine covers about celebrity pregnancies, post-baby bodies, more than doubled. And since then, you know, it's, as Dr. Williams said, you can't go into a grocery store or in anywhere that sells magazines without seeing multiple covers tracking the weight gain of pregnant celebrities and their specific weight loss plans. But of course, there are always, you know, there are quotes from people who are hawking their diets and their, you know, celebrity fitness plans. This is all very much tied up with a very profit-driven. And this is a quote from a woman we interviewed. If the bump isn't big enough, the celebrities are starving themselves, but if it's too big, they're pigging out. And of course, they're failures if they aren't a bikini in 6 days after giving birth. If women aren't allowed to have even a millimeter of fat on their bodies, even in pregnancy and pregnancy, it's like we're not allowed to be human. Yeah, pretty much. that sums it up right there. And you know, it's also for celebrity moms. You know, if there's a celebrity who has given birth within the last year, it's pretty much a given that they will be asked about their weight loss plan and how did they get the weight off and what are they doing to get the weight off. So it's become this expectation that that's what we should be focused on, and that we should all have this plan in place and whatever that plan is. And you know, unfortunately, I think most smart women know that celebrities have access to many more resources than the average woman. You know, they have professional trainers, they have personal chefs, they have nannies, and many, many more resources. But you know, even the knowledge of that, it's helpful from a media literacy perspective. But at the same time, you're still exposed to these images and these messages constantly. So that's why I really just recommend like a total detox from this stuff. If you know you're sensitive to it, like don't buy these magazines, don't even look at them. Just take them off take them out of your universe as much as you can. You're still going to see them around, but you know, don't read this stuff. It's really toxic. And yes, there's a huge profit web that is now capitalizing and has identified pregnant women and new mothers in particular as a market. So the more insecure we feel, the more we feel that this expectation to lose weight is normal, the more money we're going to spend. So you know, it's important to keep that perspective. And you know, this Body Watch headline was pulled out of magazine. That's an actual feature in a regular feature called Body Watch. So you know, it's like they're regularly watching the bodies of celebrities and reporting on it. So this is the level of madness that we've reached. So I think as we think about becoming parents and becoming mothers, it's important to just ask yourself basic questions. One and one. What behaviors and attitudes about food, weight, and body image do I want to pass on to my child, and do those behaviors and attitudes match my own? And again, this isn't about being perfect. We know that we're going to have tough days, but the goal is to get that answer to be as close to yes as you can, and to be actively working on that, and to really make that a priority for yourself. This is actually taken from Does This Pregnancy Make Me Look Fat? And what we did was we surveyed women and asked them to describe their bodies. And we had an artist put those words into 2 illustrations. So first we did was words that had negative connotation, women we talked to who clearly were really struggling with their body image. And just to really visually show how, when we feel this way and when we talk about and think about ourselves in this way, how it does impact our children in a direct way. But on the positive side, there were women who had really great things to say about their bodies and felt good about themselves. And so to really strive for that and to be actively working toward it. Again, it's not a perfect process. There are going to be challenges, but the key is to be clear with yourself that you're working on it and that you're, again, reaching out for help when you do have those bad days and you are feeling tempted to describe yourself with those negative words. This is the Healthy Beauty Pledge for Mothers and Mothers-to-Be. This is from Does This Pregnancy Make Me Look Fat also. And we wanted to come up with sort of some key points to sum up the issues that came up for almost all of the women we spoke to for the book. And, in the form of really advice, but also just what you can do for yourself and what you can promise yourself as you're going through this process. Number one, acknowledge that there's no such thing as the perfect body or the perfect mommy. So to try to get past this temptation to go into the areas of perfectionism that are so much a part of this. I never define my self-worth according to the number on the scale or the size of my clothes. Make decisions that are right for me. They don't have to be right for everyone else. That is a big one. Again, ask for help when I need it. Take care of myself and take time for myself, even if some days I can only manage 1-minute increments. And as a mother, I can tell you that there are days that will be like that, but to really try to make time for self-care, even if it's as in little. Separate the retouched, made-up fantasies in the media from what matters most to me in reality. And parenthood can put that in perspective. Work on developing a relationship with food that is about health, nourishment, and enjoyment, not deprivation, indulging, and punishment. Stop the body-bashing talk, friends, colleagues, partner, and family. And let me tell you, particularly in the new mom phase, and even when you're joining support groups for moms or new mom groups, there is a lot of body comparison talk, and it's really something to be aware of and be prepared for, and to think of yourself as, well, I can not engage in it, but also try to shift the conversation. For me, sometimes it's just, again, like that, even that piece of like, hey, I didn't weigh myself, and everybody's like, what? And then it opens up a conversation where you can actually go in a different direction and talk about, well, I didn't for this reason, and it was actually really an eye-opening thing for me in my conversations with friends. Again, give up this mission to get your pre-baby body back, and start focusing on moving forward. And that's, I think, one of the craziest things about that, getting your body back term. because it's like you're not moving backwards, you're moving forward in a big way, in a new way in your life. So to really, again, make that the focus, and to remember that 1% at a time, healthy beauty is a revolution for ourselves and for our children. And I think that's, again, we're up against a lot. We're up culturally. There are so many messages that are, trying to keep us focused on all of the wrong things. So the more we can be, for ourselves, make those changes, and also be leaders in changing the conversation for others. And that's the revolution part of it. So thank you all for listening, and that's my spiel.
Awesome. Thank you so much, Claire. And we're going to put up some resources here, and Ellen's going to go over these while I am just going to be accepting some questions. We'll have just a couple minutes, either for Claire, Dr. Williams, or both. And I know we have a couple that have already come in, so if you want to get yours in, go ahead and type it in. And Ellen's going to go ahead and talk about some of our resources while you're doing that.
Yeah, so here are some of the resources we have. First, NIDA Navigators. NIDA Navigators are volunteers who have personal experience with an eating disorder, either themselves or they're in support of a loved one. And if you feel like you could benefit from speaking with someone who's been through it, if you need a little extra support, email pffnetwork@mynida.org, and we will absolutely connect you with a NIDA navigator. Also, our PFN webinar series have quite a few recordings. If you go on the NIDA site, under the webinars page, including a webinar on an eating disorder by any other name and one on medical management. We also have our PFN publication, quarterly magazine, Making Connections, with featured articles including how common are eating disorders in pregnancy. And you can find that as well on our NIDA site under the Making Connections tab. The NIDA website has such a ton of information and resources on it, so please check that out, nationaleatingdisorders.org, including a whole section on pregnancy and eating disorders. Our Parent Toolkit, comprehensive information about eating disorders, treatment options, how to support your child, insurance issues, and more. NIDA's information and referral helpline, including a click-to-chat option. You can call the helpline Monday through Friday, 1-800-931-2237, and there are specific resources available on pregnancy and eating disorders that you can request. Also, GERSA books, publications and books about eating disorders. That you can find that at bulimia.com. And we also have NIDA Awareness Week coming up, February 23rd through March 1st. And there'll be the new NIDA site will be launched very soon, and it will have a ton of information on ideas and guides for how to get involved, articles, videos, and much more about learning about eating disorders. And also, we're planning for our annual NIDA conference, which next year in San Antonio, Texas, October 16th. A call for proposals is also open, and you can find out more about that on the NIDA site as well. And I think it's now time for some questions, so please feel free to write in or raise your hand.
Great, thank you, Ellen. We just have a couple minutes for final questions, and we've had a couple that came in on the topic of trauma. And so this question is for you, Dr. Williams, and also for you, Claire, if you have anything to add, which is, should people disclose any history of sexual abuse to your health care provider? And also, do you know why pregnancy may commonly trigger past trauma? Is it mostly related to family dynamics or other issues? So Dr. Williams, any thoughts on that?
I definitely think that being open with your healthcare provider about prior trauma can be a really great idea. It could be very therapeutic. On one aspect, it will help them in relating to you, knowing that you have that past history. They may need to be a little bit more gentler, especially when we're dealing with things like pelvic exams and things of that nature. And also, it might be an avenue for you to get some additional help. There's other therapeutic modalities. I think it's very interesting. In the past, we always felt like you can't deal with the trauma and the eating disorder at the same time, because if you talk about the trauma, they're going to become unglued and they're not going to be able to eat and all of that. And then I think what we found over time is that you really have to deal with those concurrently. If the trauma is what's fueling the eating disorder, if you don't address it, then you're never really going to help them get towards true recovery. So I do think that it's important to let your healthcare provider know. I think it's important to treat the eating disorder and the trauma side by side. And there was one other aspect of the trauma. I forgot the last part of the question.
Oh, the question was, do you know what it's related to in terms of family dynamics or something else? Like what is it that triggers those past traumas about being pregnant?
I think it could be multifactorial. I think that family dynamics are a huge piece. I just think changes in your body and an increased awareness of your body can also trigger some of those thoughts. It might be some of the interactions with the health care providers and the types of exams and things that you need and fears about that. So I think it could be multifactorial.
Great. And Claire, would you add anything to that?
No, just based on speaking to other women about it and about their, what it was definitely a combination of things, but certainly I think the increased awareness of body changes seemed to be a trigger, and as Dr. Williams mentioned, there are a lot of exams, and that can also trigger. So yeah, I would just echo what she said.
Great, thank you. And we had somebody type in a question saying that their sister just had her second baby boy yesterday, and with their first son, the family felt like she had underfed the son because she didn't want the baby to get too fat. Is it normal for new mothers who've had an eating disorder or have an eating disorder to be obsessed with what and how much their babies Dr. Williams, is that something that you've come across before?
Absolutely. We've seen that quite frequently, and in fact, I can think of some patients that I've had where they actually came into treatment as a result of the intervention by the family members because they were underfeeding their children. And so that is an aspect, and maybe, as I stated before, if it's a fear of gaining weight or the children becoming overweight, or there's just so much, as we've talked about during this entire talk, that can go into your thoughts as a new mom, and it's definitely an area of vulnerability, and it's one of the things that we look out for. So just as we would want to monitor and make sure that mom's weight remains appropriate, that's also an important piece to look at the kids, and I have seen that before where the child isn't gaining appropriately and that the family has to intervene with mom.
Great, thank you. And Claire, did you want to add anything to that come up in your book?
Yeah,
research?
Yeah, I think, well, one of the things, and we touched on this with the breastfeeding piece, I think several women I talked to really struggled with having to eat more to be able to breastfeed. And one of women we interviewed actually had to stop because of that, and as similarly to what Dr. Williams described before, just deciding that it just wasn't good for anyone. So yeah, that came up in a few.
Great, thank you. And I think I'm just going to ask this one final question here because I know we're just at the end of our time, so we'll fit this in quickly. Somebody had asked, how can you bring up to your eating disorder professional or OB or even close family and friends if you fear they may not understand because you don't have the typical body of someone with an ED, typical in quotes. Dr. Williams, would you like to address that?
Sure. So I think that that's part of our job as eating disorder professionals, is to get the word out there that there is no typical body of an eating disorder, that eating disorder comes in all different shapes and sizes, and that it has more to do with the thoughts and the behaviors versus how someone looks. And I do think that that's a common misperception. And so I think that just being honest with your healthcare provider about the symptoms that you're having. There's also lots of great resources out there for providers who maybe are not as well versed in eating disorders in terms of things to look for and things to ask about. I know the Academy of Eating Disorders specifically has a really good handout for providers. So I would encourage anyone who is struggling with an eating disorder, who has struggled in the past, to just be able to speak with their healthcare provider about that, and it might really be a real teaching opportunity for them to learn more about the fact that there is no typical way that an eating disorder looks.
Great. And any final comments on that from you, Claire?
Yeah, I think I would agree with that. The only thing I would add is that, you know, if you're talking to your healthcare provider and you feel that they have a total lack of understanding or sensitivity, you can switch providers. You know, we talked to so many women who stayed in a situation or stayed with a doctor or OB who made very insensitive comments or had a total lack of knowledge about their issues, the issues they were struggling with, because they felt, you know, that they had to or they were afraid to speak up for themselves. So it's really important that if you feel like it's not a good match, that you can look for someone else. And, you know, you should look for someone else because it's important. You know, it's important that you feel safe and heard, and, you know, that you don't have to stay with someone, shouldn't stay with someone who you feel is going to be not sensitive to the issues that you're struggling with.
Great, thank you. And unfortunately, we are out of time tonight, so we'll go ahead and wrap up the webinar. We want to thank everyone who took time to be here tonight to listen, and thank you so much to Claire and to Dr. Williams for taking your time to put this presentation together and answer people's questions. It's been really informative and helpful. As Ellen mentioned earlier, we're definitely going to be putting this on the NIDO website in the webinar section under the media tab, and we'll be following up with a link to that once it's archived as well. So you can always go back and review any of this that you'd like. If you have any questions that come up after the webinar, of course, feel free to email us, and we will try to get those questions answered for you. And so I think with that, we'll go ahead and wrap up for the night. So thank you, everybody. It's been great, and I hope you'll join us again for our next PFN webinar series.
Thank you. Thanks.